My period started, and boom, all the pain was back. It was like the bone marrow was on fire.
She would scream out in pain. Tears would roll down her face.
Every month, the bumps would get bigger and bigger.
I just didn't know what to say, didn't know what to do.
The good days were just slipping away until there weren't any.
Next, two medical mysteries that defied the experts. Holly Pushevsky's doctor suspects she may be infertile and can't tell her why. But when harrowing leg pain suddenly set in during her period, she begins to wonder if there could be a link.
I was just so frustrated. It didn't feel like the doctors were listening to me.
There was something seriously wrong.
We didn't have any answers. And I thought, are my hopes of having a child really hopeless?
Then, just after Tina Ankar celebrates her 16th birthday, bizarre bumps begin forming on her heels. Little does she know that over the next 10 years, her body will transform in ways she could never have imagined.
It wasn't normal to see the different bumps on her body. It blew my mind, really.
I was very worried. My worst fear was dying.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In the summer of 2004, 29-year-old Holly Elkins and her boyfriend, Mike Pushevsky, had just eloped and were eagerly looking forward to starting their new life together.
Mike just had this great sense of humor, and I just felt like he really got me.
She was funny, very smart, obviously very beautiful. It felt real easy to be around her.
Mike and I moved to Missouri at the end of August, just after we got married.
When we first moved here, I took a sales position at a resort.
I worked for a dance theater company in Branson. We had family in the area. My sister has a little girl, and spending time with my niece really gave me that extra push that I was really ready to start a family.
And for the 42-year-old Mike, there's an even greater sense of urgency.
I didn't want to be 60 years old and playing with the 5-year-old out in the backyard.
I didn't have any health issues. I was feeling great. I never thought that I would have any issue at all getting pregnant.
But a few months after the newlyweds decide to start their family, Holly notices a strange pain in her right leg.
It was just a deep ache.
It was kind of a vague pain, more like soreness. It really didn't seem like anything more than a pull or a strain.
After a few days, the pain goes away, only to return several weeks later. It's the beginning of an odd pattern. Every few weeks, Holly gets a dull ache in her leg that subsides within about 4 days.
There was so much more on my mind, so I just kind of pushed the pain in my leg to the side and didn't pay attention to it.
Instead, Holly remains focused on getting pregnant. But 6 months later, the couple is still trying.
We never thought it would be that difficult to have a child. The OBGYN suggested that we chart her ovulation so we could find the optimum time to try to conceive.
And so we started doing ovulation tests. We started charting my cycle. But things weren't going our way. It started to get difficult. And then it started to get really heartbreaking.
We went to see Holly's OBGYN regarding the problem. She did a sperm analysis for me, and that came back fine.
It meant that the burden, I guess, was shifted to me. I felt like I was broken. I decided that I had to try something else. It wasn't working. We discussed our options as far as fertility treatments. we decided to go ahead with a fertility medication that we would try for 3 months. If that didn't work, then we would probably go forward with the in vitro fertilization.
She started a fertility drug that would help her ovaries produce eggs. We both were holding out that this would help us.
But a few days after taking her first cycle of medication, Holly notices something unusual.
The pain in my leg increased. There was like this deep pain in my buttock and my hip at the same time. It was like the bone marrow was on fire, and it started to feel like my femur was ripping through my butt muscles. I knew I had to see a doctor right away. I told the OBGYN that I was having pain when I started taking the fertility medication, and she said that endometriosis could cause pain like this and cause infertility. So I thought, great, we've got the answer to both problems.
Endometriosis is a condition in which tissue that normally lines the uterus grows in other areas of the body, usually the fallopian tubes or ovaries. It can cause both pain and infertility.
She suggested that Holly have a pelvic laparoscopy done as a diagnostic sort of surgery.
3 weeks later, Holly is wheeled into the OR for the procedure.
While they were doing the surgery, I think every possible thought ran through my brain. I didn't know what they were going to find when they went in there.
The results of the exploratory surgery stun everyone.
The OBGYN said she didn't find any endometriosis at all. Everything looked fine.
We didn't have any answers. We didn't know what was causing the pain. We didn't know why I couldn't get pregnant. And I thought, are my hopes of having a child really hopeless?
Ever since Holly Pushevsky started taking fertility pills, she's been experiencing an intense pain in her right leg that mysteriously comes and goes. On top of that, after undergoing exploratory surgery for endometriosis, Holly's uterus appears to be perfectly healthy.
The doctor didn't know what the answer was.
It was extremely frustrating.
Puzzled, the doctor takes Holly off the fertility pills in hopes that the pain will eventually subside.
I couldn't do the medication anymore. It was just increasing the pain far too much in my leg. But I was still keeping the ovulation charts. There was definitely still a part of me that hadn't given up hope that I was going to be able to have a child on my own.
But despite cycling off the medication, the excruciating bouts of pain only intensify.
Both the severity and the duration of it increased. It was the worst pain that I had experienced to this point. The real focal point of where it felt like the pain was radiating from was in the very center, deep, deep in my right buttock.
She would scream out in pain. Tears would roll down her face.
I started having trouble walking in that I wasn't really able to weight bear very much onto my right leg.
With no idea as to what's causing the painful episodes, Holly's doctor refers her to a physical therapist.
And after the first couple of weeks, I thought, this is really working. I'm feeling better.
Holly was walking better. Obviously, she was feeling better because she was in a much better mood.
It was like I was back to my normal self again.
But just when Holly thinks she's out of the woods for good, the attacks return with a vengeance.
My period started, and boom, all the pain was back. On a scale of 1 to 10, this was a 15.
And we just took a giant step backwards. I thought it was very weird.
I went back to the physical therapist, and I told her about how the pain had started again right when my menstrual cycle had started. And the physical therapist kind of stepped back and she said, "I can't treat you." She was afraid that she was going to do something that was going to cause more harm than it was going to help, because she didn't know why the pain was back.
Now, Holly is convinced the pain is in some way connected to her menstrual cycle.
And the week before my period, I would be totally pain-free. And as soon as my period started, the pain would shoot through the roof.
We thought that there was something seriously wrong, and in some sort of bizarre way, it was tied to her menstrual cycle.
We met with the OBGYN. It was like, well, maybe this is it, maybe it's not. Because she hadn't figured it out, it was like it really wasn't even a possibility.
Unpersuaded by Holly's hypothesis, but without one of her own, all the doctor can do is prescribe medication for the pain.
I was prescribed narcotic-level painkillers and a muscle relaxer. It was basically just a way to try to manage the pain, but we didn't have any answers.
It really seemed like the doctors were too eager to throw up their hands and say, "I don't know, here's a prescription for the pain."
Undeterred, Holly visits several doctors over the next few months and walks them through her theory of a menstrual cycle link. But no one is buying it.
I was just so frustrated. It didn't feel like the doctors were listening to me.
We really felt like her pain was cycling with her periods. We just didn't know why or how.
And with each new episode, the pain seems to be growing more debilitating.
It was getting progressively worse every month.
The intensity of the pain increased and the duration of the pain increased. I would have about 1 to 1.5 good weeks out of the month. The rest of the time, I was in pretty severe pain.
She couldn't bear weight on that leg. It was very painful for me to watch her have to go through that.
Walking is now a struggle, and it isn't long before Holly notices the strength in her right leg beginning to wane.
I started having to use a cane to get around. It got to the point that the pain was too much. The cane didn't even help me walk. I couldn't walk at all. I was crawling on the floor. I was pathetic. The good days were just slipping away until there weren't any. Mike had to take care of pretty much everything for me, and I was scared that there was going to come a time that he was going to say, "I can't do this anymore. It's too much of a burden and I can't carry it." And I had no idea where that was going to leave me, because I couldn't take care of myself.
Desperate for answers, Holly makes an appointment with a doctor who specializes in physiatry, or the rehabilitation of movement.
He did an exam to see what my range of motion was, and he decided that we needed to do an MRI of my hip.
We were hoping that it would show something that would give us some sort of idea what was causing the pain.
4 days later, the doctor calls her back. But little does Holly know, her entire world is about to be turned upside down.
It was kind of odd for him to be calling me himself, and I could tell that his voice was shaken. Something was wrong. He said that there was a mass on my sciatic nerve. And he kept talking, but all I heard was a mass, a mass, a mass. The doctor had never seen anything like this before.
After enduring 2 years of incapacitating leg pain, Holly Pashevsky has received terrifying news. There's a bizarre mass growing on her sciatic nerve, a major fiber that starts in her lower back and branches down into both her legs.
He said it's blood-filled, it's bleeding. It's about the size of a ping pong ball.
The doctor is mystified, but he does agree there may be something to Holly's theory of a menstrual cycle link. That same day, he refers her to a specialist, Dr. James Shriber, head of the OBGYN department at Washington University in St. Louis.
Whatever this mass was in her leg was pressing on the major nerve of the leg, which is sciatic nerve. The vast majority of the muscles of the leg are controlled by the sciatic nerve.
But Dr. Shriber won't be able to determine what the mass is or how to treat it until a pathologist examines it.
Dr. Shriber said I had to have surgery and I had to have it right away. The purpose of the surgery was to remove the mass that had built up and matted down the sciatic nerve.
The surgery offered hope, but it also offered risk and even danger.
If something went wrong with the sciatic nerve, then I would be paralyzed. I told Dr. Shriber that I would be okay with the surgery, but I had to have him there with me.
Finally, on a cool May morning, the doctor takes Holly in for surgery at Barnes Jewish Hospital in St. Louis.
He really seemed to have a good game plan, so that on one hand kind of put me at ease, but also on the other hand, I was scared to death.
I was okay until they put me on the gurney, and part of me thought, I'm gonna die.
A million thoughts ran through my brain. What happens if something goes wrong? Is everything going to be right?
The idea of the surgery is to remove the majority of the mass so that this won't all form again and to relieve the pressure on the nerve. Once the mass was removed, all of the tissue was sent to pathology, and then they looked under the microscope. But in the midst of this mass, they saw normal endometrial cells. Based on the analysis of the tissue that was removed at the time of surgery, Ms. Pvvy was diagnosed with sciatic endometriosis.
Sciatic endometriosis is an extremely rare disease that affects the sciatic nerve. When a healthy woman menstruates, the cells that make up the uterine lining are shed and blood flows out of the body. But in women with sciatic endometriosis, for some unknown reason, cells that line the uterus migrate to the sciatic nerve. As a result, blood is trapped in random areas along the nerve, triggering inflammation and ultimately leading to the buildup of scar tissue, which compresses the sciatic nerve.
One would presume that there is an event. Some cells from the uterus somehow get into the bloodstream and then travel to that area.
This may only be a one-time event, but once the initial cells migrate from the uterus to the sciatic nerve, they simultaneously bleed each month when Holly has her period.
So every time I had a period, I was having a menstrual cycle in my leg. I thought that was crazy.
Then in the second half of the cycle after ovulation, you have the uterine lining getting ready for pregnancy. When pregnancy does not occur, the surface of it sloughs off, and you get bleeding from the vessels associated with it. This entire sequence also occurs wherever endometrial tissue is, and in this case, it happened to be in the leg. It's different than in the uterus where you have an exit. Here, it's trapped in the leg tissue, and then the bleeding causes enormous tissue reaction around it. That would then trigger stimulation of the pain nerves in the sciatic. We don't know how long it's been in Ms. Pvvy's leg. Why it happened then and not earlier, I have no idea.
But with a diagnosis finally in hand, it's now clear that all of Holly's symptoms are a direct result of the disease.
The cyclic pain that Ms. Pvvy noted in the beginning of this whole process probably was a direct reaction of the blood. The bleeding from this is really microscopic, but it sets off this whole cascade of inflammatory responses, one of which is pain.
And the pain was only exacerbated by the endometriosis, which took off with a vengeance when she started taking the fertility medication.
The medicines that she received to stimulate the ovulation would also cause her estrogen to go higher than it would in a normal menstrual cycle. Estrogen causes endometrial cells to divide, and so it is gasoline to the fire.
And with each passing month, more blood and tissue became trapped, eventually forming large swaths of scar tissue.
The Scar tissue was matting everything down, compressing the nerve, squeezing it.
The difficulty with walking is a result of compression of the motor nerves. You prevent the motor nerves from working. Without the nerves, the muscles don't work, and you have difficulty walking.
Every one of the symptoms made sense. It really seemed so simple.
But the one thing the couple is desperate to know more than anything else remains a mystery. Will Holly ever be able to conceive?
After the surgery, we both still had this big question mark hanging over. Why can't we have a child?
For the last 2 years, Holly Pashevsky has endured debilitating leg pain and struggled with infertility. Now, a diagnosis of sciatic endometriosis has accounted for the pain, but she still doesn't know why she's infertile.
Endometriosis is related to infertility, but sciatic endometriosis, I can think of no reason why that in and of itself should cause infertility.
I thought if I had endometriosis, that would be the answer to my infertility. And now, that wasn't the answer.
But while doctors are unsure why Holly is infertile, the sad truth is she will never be able to get pregnant. In order to keep the sciatic endometriosis from returning, she'll need to be on medication that stops her from menstruating.
Treatment plan suppresses estrogen production and it leaves endometrial cells from dividing. It causes cell division to stop.
So hopefully that'll keep the endometriosis at bay.
It is a form of birth control, so it would be very tough for her to become pregnant because it should suppress ovulation. It is possible that she'll be on this until menopause.
Emotionally, it's still hard because the way that we treat the disease now is through hormone manipulation. I wanted to have a baby, and if I don't want this to come back, then that's really not an option.
We probably aren't ever going to have children of our own, so we're strongly considering adopting a child.
It's a difficult pill for the couple to swallow, and it's only compounded by their confusion over why the diagnosis wasn't made sooner.
The majority of endometriosis is found in the abdomen and the pelvis, but in her case, it really was just localized to her leg. Quite extraordinary. It's such a rare phenomenon. In my whole career, I've seen it twice. I was surprised to see it the first time, and I was flabbergasted to see it a second time. Pain in the leg or pain in the back is almost universal. I have it, and I don't have endometriosis.
In fact, less than 100 cases have ever been reported, and Holly dodged a dangerous bullet by getting diagnosed when she did.
It was going to get to a point that the nerve was just going to be compressed so much that no signals would go down my leg, and I wouldn't have the use of my leg anymore.
Eventually it could result in paralysis of the leg, which would be quite catastrophic.
Today, with the help of physical therapy, Holly has regained much of the mobility in her right leg.
We're working on trying to get the flexibility and the strength back into that right leg.
Holly's prognosis is excellent. She's gotten good relief from pain, and she's had good return of muscle function. So the problems that she has suffered from for the last several years are largely gone now. I'm really pleased for her and happy for her and her husband.
Physically, I feel pretty good most days. I feel a lot better than I did 6 or 8 months ago.
This experience has shown me how much I love my wife, how important she is to me. It certainly was very easy for us to see how much we loved each other, how much we depended on each other.
Regardless of what Mike had to do, he was there with me every single minute of this. And he never let go of my hand, and he never let me fall.
While Holly Pashevsky's episodes of debilitating pain left no doubt something was seriously wrong, Tina Ankar had no idea that her disfiguring symptoms were a sign of a disease that could cost her everything. When Tina Ankar was growing up in Gretna, Louisiana in the 1980s, by all accounts, she seemed to be a healthy and happy child.
I like playing outside with my friends, playing baseball and football.
She played hopscotch and games with her sisters. Raising girls was a lot of work. I worked at a service station, and my husband was a fisherman.
My mom and daddy worked very hard to take care of us. She was a very loving mother, and she'd do anything for me.
Life is good for Tina until she enters middle school and begins having problems with her schoolwork.
It was very hard. I couldn't even see the writings on the board. I always had trouble understanding things, and I told my mom, let's go to the doctor.
We had gone to the eye doctor, check her eyes.
And the doctor said that my eye was blurry and cloudy and everything. And he said I had cataracts. I had no idea what cataract was.
A cataract is a clouding of the lens of the eye. A variety of health issues can cause it, including diabetes. But cataracts are very rare in children and often associated with serious disorders.
And he said she's gonna have to have cataract surgery. It blew my mind, really.
I was very nervous. I didn't know what was going on.
Although the doctors can't explain Tina's cataracts, there's no question they need to be removed. And just 2 weeks later, 11-year-old Tina is wheeled into surgery.
Everything just went smoothly during surgery, and her eyesight improved a whole lot.
But while her vision is greatly improved, Tina continues to have trouble keeping up in the classroom.
Anything that had to do with memorizing, she had problems with. She might learn it today, and then tomorrow, she forgot what she learned.
They put me in special education because I was slow.
It was tough watching her trying to learn.
By the time she's a junior in high school, Tina and her mother have accepted the fact that some things will always be difficult for her. But nothing could have prepared them for what happens soon after Tina turns 16.
I was at home taking a bath, and I noticed the bumps on my foot.
She came to me telling me that she found 2 bumps on her heel. I have never seen anything like that before.
Over the next 3 months, the strange growths double in size.
It'll get bigger, a lot bigger.
It was about the size of a golf ball.
It was very weird. I didn't know what it was. We had to go to the doctor.
At the local hospital, an orthopedist carefully examines and x-rays the odd bumps, but can find nothing out of the ordinary.
The doctor didn't know what it was, and he could not explain anything to us.
Discouraged by the experience, Tina and her mother do their best to simply live with the problem.
It was very disappointing. I didn't know what to do after that.
I just accepted, what she had. So it was very busy, raising all my girls, working more than full-time.
But as the months drag on, the bizarre growths are becoming harder and harder to ignore.
The bumps hurt when I was wearing shoes, but I dealt with the pain. It didn't look like my foot.
It was weird looking. I had never seen that before.
Every month, the bumps would get bigger and bigger. I was very worried about the bumps.
"16-year-old Tina Ankar has developed mysterious fleshy bumps on both her heels. And they're rapidly growing out of control.
I felt different because I had something on my body that it did not go away. I couldn't change in front of people in the gym.
She came to me and complained, "Mom, why do I have it?" And all I can do is comfort her.
Then, to Tina's horror, a third growth slowly begins to surface on her left elbow.
They were a little different. The one on the elbow was soft, and on the heel, it was hard.
I had to always wear like a long sleeve shirt or something to cover it up.
But despite her social and academic challenges, Tina is determined to graduate. And in June of 1994, she proudly accepts her diploma.
After high school, I wanted to work. I had a job bagging groceries.
She did a little cashiering. That didn't work out too good. Tina had difficulty handling money, giving out change.
But Tina sticks it out, and over the next few months saves enough money to visit a specialist.
Me and my mom went to the hospital to see what could be done.
And they examined it, did blood work, and they would measure the bumps.
But everything from her cholesterol to her blood pressure checks out. And while no one can say for sure what's causing the growths, they do appear to be harmless.
The doctors at one point told us that it was a fatty nodule.
It was upsetting for me and my mom. We didn't know what it could be. I just dealt with it.
I was hoping one day that they would remove the bumps. It wasn't normal to see her growing up with the different bumps on her body.
It's a trying time for Tina. But over the next 5 years, she learns to live with the strange bumps. And when the summer of 2001 rolls around, her life takes a turn for the better. Tina meets a young man at a 4th of July party, and the sparks fly.
I was excited when I met him. We had a lot of fun. We went out together. It was something different. Somebody I knew of.
She was taking charge of her life, which was a good thing.
But nothing could have prepared her for the news she's about to receive.
I found out I was pregnant. I was scared and also excited.
Although Tina's boyfriend isn't ready to be a parent, Tina vows to raise the child on her own. The next 9 months fly by, and on September 26, 2002, Tina gives birth to a healthy baby girl she names Alyssa.
I was very excited to have a baby. Me and my mom, she was there too when I had my daughter.
She was a beautiful baby.
She was a good baby. She didn't cry too much. She was always sleeping and just doing her baby things. Cute. It was a great thing to me. I loved it. I love being a mom.
Tina did a good job. We were there for her when she needed us.
But just as Tina's settling into motherhood, yet another bump begins to appear, this time on her knee. And it's growing quickly.
I couldn't wear a skirt. I always wear jeans and pants, not skirts, because I don't want to show the bumps. I was very worried. I didn't know what was wrong now.
At her wit's end, Tina makes an appointment with a local dermatologist, Dr. Michael Steppie.
The most important thing was to get her complete medical history. She told me that she had developed unexplained bilateral cataracts around age 12 and that she had surgery to have those removed. And then she started developing masses all over her body. I was taken back by the ones on her Achilles tendons. I hadn't seen lesions that size before.
He was very committed to what he was doing, trying to find out what was on my body.
The next step at that point was to do a biopsy on Tina's left elbow.
I had years of frustration building up to find out what was going on.
The result of that biopsy came back as a tendinous xanthoma.
A xanthoma is a firm mass under the skin which is made up of fat cells.
A single xanthoma is fairly common. It's abnormal to have multiple xanthomas, and to have the masses on her Achilles tendons that were as big as they were is very uncommon. At that point, I started to do research trying to figure out Tina's unexplained cataracts and other symptoms, trying to figure out what she had.
Finally, Dr. Steppie comes across a rare and devastating disease that seems to fit Tina's symptoms to a T.
We had to get Tina to come back in to give urine and blood to make the diagnosis.
I was nervous waiting for the results.
I was shocked considering how rare the disease is. I had the whole family come in. It was difficult to tell them.
For years, Tina Ankar has suffered from mysterious and disfiguring bumps growing on different parts of her body. But now, one doctor thinks he knows what's causing them.
I was very anxious to find out the results of their tests.
Tina was diagnosed with CTX, or cerebrotendinous xanthomatosis.
CTX, or cerebrotendinous xanthomatosis, is an extremely rare disease in which the body fails to process cholesterol properly. In a healthy individual, cholesterol aids in digestion by helping to create bile acids. In addition, it helps maintain cell membranes throughout the body. But in patients like Tina, the essential enzyme needed to break down cholesterol is missing. So, for some unknown reason, the cholesterol turns into a dangerous substance called cholestanol and abnormal acids, both of which can wreak havoc on the body and attack the brain.
She's missing the enzyme in the liver that converts cholesterol into the proper acids. The body tries to break down cholesterol, but it gets converted to cholestanol and abnormal acids. And then the body cannot break down cholestanol.
I was paused. I didn't know what it was. It was something I never heard of before. And me and my mom didn't know what to think.
In patients with CTX, the blood-brain barrier is damaged. This allows these abnormal bile acids and abnormal cholestanol into the brain.
Essentially, over the years, the cholestanol has been building up in Tina's brain, interfering with neurological activity and impairing her mental capabilities across the board.
Tina struggled in school because of the cholestanol. Disrupts the entire metabolism of the brain.
The cataracts that Tina had removed when she was 11 years old were another early sign of the disease.
This is unknown, unexplained, but my theory is that the cholestanol cannot come out of the lens of the eye as easy as the other tissues of the body.
The cholestanol is also responsible, in fact, is the main ingredient in the bumps that have developed all over Tina's body.
When cholestanol goes into the tendons and the joints, it cannot come back out. And so it builds up in these areas where you can actually see it. It's completely disfiguring.
Once I look back at all of it, it just all made sense. It all comes together like a puzzle. And it's just frightening.
Even more sobering is how lucky Tina is to have secured a diagnosis when she did.
If Tina had not been diagnosed with CTX, she would have continued to deteriorate neurologically because of these abnormal bile acids and abnormal cholestanol getting deposited into the brain. This would shut down all the organs of the body. It'd eventually develop neurologic dysfunction and then death.
My worst fear was dying.
My mouth flew open. I just didn't know what to say, didn't know what to do.
Although the damage Tina has suffered so far is irreversible, a new drug still in the testing stage has been shown to stop CTX from getting any worse.
The medicine is chenodeoxycholic acid. When patients with CTX take chenodeoxycholic acid, it will completely reverse the abnormal synthesis of cholestanol and bile acids.
Tina is enrolled immediately in the clinical trial. While Dr. Steppie is hopeful that the medication will help, he's also concerned about Tina's 2-year-old daughter, Alyssa, who may be at risk of suffering imminent brain damage.
CTX is a genetic condition. It's critical that you diagnose patients with CTX as early as possible. If you diagnose patients with CTX before any of the symptoms, they will never develop xanthomas and the neurologic dysfunction. And so it was the utmost importance to have Tina's daughter tested for CTX.
I was nervous because I didn't want her to carry my genes.
Tina was very distraught and very upset. She did not want her daughter to have to go through what she's gone through from childhood.
Finally, after an anxious 3-week wait, Dr. Steppie is able to establish a clear prognosis.
Alyssa's blood and urine came back as that she's a carrier, but she will not develop the disease.
I was happy to find out that she didn't have the disease.
And there's more good news for Tina. It appears the medication from the clinical trial has halted any further brain damage, and Dr. Steppie is now confident it will keep new growths at bay.
Since I started taking medicine, my symptoms have been getting a lot better.
Tina just needs to continue to come in for her regular checkups to be evaluated for her neurologic status and to stay on the medicine.
I had to take medicine for the rest of my life.
After years of struggling to live with the disease, it's a great relief to finally have it under control. But now the family can't help but wonder why it took so long to get a solid diagnosis.
CTX is difficult to diagnose because when doctors test the laboratory and chemistry of the body, they check for the regular cholesterol and they miss the abnormal cholesterol. And that's why doctors miss this diagnosis.
Today, 4 years after her diagnosis, Tina is living a full and happy life. She's focused on raising her daughter and is saving money to eventually have the bumps surgically removed.
Tina is doing very good today. She seems more alert than ever.
Tina is doing great. She's taking the medication. She's taking a hold on her life, looking towards the future. Alyssa will grow up into a fine young lady, and she'll be able to take care of herself, not having the disease.
I just want my daughter to know that I love her so much. I'll do anything for her.
The whole experience, it's hard to put into words. It's been a long, hard road, and I just thank God that we're here to see the outcome.
I feel wonderful today.